Heavy menstrual bleeding is a condition that is characterized by excessive or prolonged menstrual bleeding. It is actually difficult to define precisely what constitutes heavy menstrual bleeding because the amount of menstrual flow can vary significantly from lady to lady. However, there are some general guidelines to help determine if the periods are abnormally heavy. Some of those parameters will be duration. If the period lasts longer than 7 days, if the flow soaks through a pad or tampon within an hour or less, or if you're passing large clots during menstrual flow, if they are larger than a quarter, it's often an indication of heavy menstrual bleeding. But symptomatically, if you experience symptoms of anemia, such as fatigue, weakness, shortness of breath during period, it could be as a result of this. There's also lifestyle disruption. If the period significantly interfere with your daily activities, such as constantly having to go to change your sanitary products in the toilet, limiting your social engagements, or even affecting your quality of life, might be an indication of heavy menstrual bleeding. But in general, if you suspect you have heavy menstrual bleeding, it is important to consult with your gynecologist. They can then evaluate the symptoms, conduct examination if necessary, and they can recommend the appropriate treatment options. There are several potential causes of heavy menstrual bleeding. Some common causes that I see in my practice include an imbalance between estrogen and progesterone, which is referred to as hormone imbalances, because those two hormones regulate the menstrual cycle, and this can lead to heavy menstrual bleeding. Conditions such as polycystic ovarian syndrome, commonly known as PCOS, or hormonal disorders may contribute to this imbalance. Fibroids, these are benign growths of the uterus. They cause enlargement of the uterus, and they cause heavy or prolonged menstrual bleeding, because the amount of bleeding that you produce in the menstrual cycle is very much dependent on the size of endometrial cavity. So the fibroids can increase that size, and as a result, consequently, increase the amount of menstrual loss. Another condition which is not easily seen and commonly diagnosed is adenomyosis, because what is adenomyosis? Sorry, this is a condition when tissues that lines the uterus, the so-called endometrium, begins to grow into the muscular walls of the uterus, and this can also result in heavy menstrual bleeding. Other simple common causes will be endometrial polyps, enlargement of the lining of the womb, endometrial hyperplasia, or certain medications such as the use of blood thinners, anticoagulants, or some types of hormonal contraceptives can lead to heavy menstrual bleeding. Not to forget about certain bleeding disorders. In some cases, there are underlying disorders such as von Willebrand disease or platelet dysfunction disorders, and these two can cause heavy menstrual bleeding. In terms of diagnosis, the cause of heavy menstrual bleeding will be made by your gynecologist, and they might perform a number of medications, but like all clinical diagnoses, they are based on three things: good medical history, physical examination, and where appropriate investigation such as blood tests, including complete blood, full blood count to check evidence of anemia or hormonal levels. There are radiological or imaging tests such as ultrasound scan to examine the uterus and ovaries for any structural abnormalities such as fibroids, polyps, or even polycystic ovary. And in some cases, especially in ladies who are over age 40, a small sample of endometrial lining called endometrial biopsy may be taken to evaluate any form of abnormal cells lining the womb. Some of these can be performed using a simple suction, or sometimes you might require passing a camera through the inside of the womb called hysteroscopy to take the biopsy. Oh, yes, there are several effective treatments available for this condition, and the choice of treatments obviously depend on the precise diagnosis, i.e. the underlying cause, the severity of the symptoms, the age of the patient, whether you are in the reproductive years and reproductive plans. Let's look at some of the common treatment options. Medications, the most commonly occurring medications are non-steroidal anti-inflammatories called NSAIDs, such as ibuprofen. They help to reduce menstrual bleeding and relieve pain. The commonest medication in my practice is the use of tranexamic acid. The medication helps to reduce menstrual flow by preventing blood clots from breaking down. But there are hormonal contraceptives, i.e. the birth control pills, hormonal patches, or hormonal intrauterine devices, the most popular being Mirena intrauterine system, and of course, contraceptive injections, which can regulate the imbalance and reduce the bleeding and relieve menstrual pain. Progestin therapy, which is a mini pill or injections, they help to release progesterone to regulate the menstrual cycle and reduce the bleeding. But there are non-hormonal treatments, obviously to supplement the range blood counts. The commonest is iron supplements. If bleeding can lead to anemia, and iron supplements may be considered or prescribed to restore the iron levels. And endometrial ablation. And this procedure involves removing or destroying the lining of the womb. As I said earlier on, the bleeding that you have in the menstrual cycle is as a result of the shedding of the inner lining of the endometrium. And therefore, in theory, if you remove this lining, there will be nothing to shed. Therefore, there should be no bleeding. But in practice, especially in young age before the age 45, what you get is a reduction in the menstrual bleeding rather than lack of bleeding. But there are other surgical interventions, such as hysterectomy. In very severe cases, and especially when the family is complete, where other treatments have not been very effective, surgical removal of the uterus, hysterectomy may be recommended. This is considered a last resort option, and the risk of hysterectomy for heavy menstrual bleeding has decreased dramatically in my practice. But this is particularly useful for patients who no longer desire fertility. But there's also the scope for mammectomy. This is removing the uterine fibroids that is causing the bleeding, and this can be performed while preserving the uterus, and mammectomy can be performed in patients who want to more or less retain their reproductive capability. An endometrial resection or endometrial ablation is a sort of surgical procedure which is not as invasive as hysterectomy, and it involves destroying or ablating the lining of the uterus to reduce or eliminate menstrual bleeding. Other treatment options, such as the so-called GnRH analogs. These are medications which temporarily induce menopause-like state to reduce heavy bleeding. They are typically used for short periods of time before other treatments, such as before surgery. And not to forget uterine artery embolization. This is an X-ray or radiological treatment. It is a minimally invasive procedure. Small particles of substances are injected into the blood vessels, which supplies the uterus to block the flow of blood, thus reducing the bleeding. The appropriate treatment option will depend on your specific circumstances, and this should be determined in consultation with your gynecologist. Obviously, the gynecologist will consider factors such as the causes of heavy bleeding, your overall health, your reproductive plans, whether you want to have more children or not, and your personal preferences. Oh, yes, heavy menstrual bleeding can sometimes be a sign of we alluded to some of this. Some of the potential causes of heavy menstrual bleeding, which I talked about, will include things like fibroids, adenomyosis, polycystic ovarian syndrome, endometriosis, hormonal imbalances, and of course, pelvic inflammatory disease, which is an infection of the female reproductive organs. They're typically caused by sexually transmitted diseases, and it can cause heavy menstrual bleeding along with pelvic pain and other symptoms. And of course, I also mentioned about blood clotting disorders from Willebrand disease, because certain blood disorders will result in heavy and prolonged bleeding. These are just a few examples of the many potential underlying causes of heavy menstrual bleeding. And if you experience unusually heavy or prolonged periods, I think it's important to consult with your GP or your gynecologist. They can evaluate your symptoms, conduct any necessary tests or examinations, and provide an accurate diagnosis, because accurate diagnosis is extremely important, because appropriate treatment options can be channeled to the diagnosis. While it's always important to consult with your GP or gynecologist for personalized advices, there are some measures that patients can take to manage heavy menstrual bleeding at home. Here are some examples. Over-the-counter pain relief, for example, I did talk about non-steroidal anti-inflammatories, NSAIDs, such as ibuprofen or even naproxen. This can help to reduce pain and inflammation associated with heavy menstrual bleeding, but it's always important to ensure that you have no allergies and that your GP hasn't given you any indication not to use any of the medications, i.e. the non-steroidal anti-inflammatory drugs. Menstrual products. You need to choose menstrual products that are appropriate for heavy flow, such as super absorbent pads or tampons. You may consider using overnight pads for added protection. Menstrual cups are another option that can hold more fluid than traditional pads or tampons. Many of my patients told me that they use heat therapy. They apply a heating pad or taking a warm bath, which can help alleviate menstrual cramps and provide some relief. But the most important, in my view, is to maintain a healthy lifestyle, regular exercise, balanced diet, adequate sleep. They can contribute to overall menstrual health. And additionally, avoidance of alcohol or caffeine may reduce the symptoms of heavy bleeding. Iron-rich diet. This can lead to increase in the level of iron, and this can help to treat iron deficiency anemia. And iron-rich foods in the diet, such as spinach, I think lean meats and legumes and fortified cereals, they help to replenish iron levels. Hydration, particularly during summertime, in fact, all the time, it's important to stay well hydrated during your period to help maintain overall health and support your body's functions. And increasingly, many patients now track their menstrual cycle. So keep a record of your periods, noting the duration and intensity of that bleeding. This information can be very helpful when discussing symptoms with an health professional. And many of my patients now come prepared with various type of apps on their telephone to give me that information. But remember, if your menstrual bleeding is excessively heavy, causing severe pain or interfering with your daily life, it is crucial not to treat yourself at home, but to seek medical advice. A health professional can evaluate your condition, identify any underlying causes, and recommend appropriate treatment options.